Hello everyone, welcome to today's lesson with Caleb Mlonga. Welcome to the part 2 of the nursing care plan for a patient with tracheostomy tube. So as you can remember from the previous video, if you've not yet looked at it, check in the comment section. So we are going to start with a problem called acute pain. So you find that in our patient here, because of the stoma, because of the surgical incision that has been performed on the neck, and because of that, there will be pain. So our nursing diagnosis is acute pain related to surgical incision and tracheostomy tube placement. So this tube is a foreign material that is being placed on the neck, evidenced by the painful facial expression. It can also be through communication. Remember, the communication doesn't have to be always verbal, because the patient will not be adequately or properly speaking. If you've not seen the first video, check it out. Go to relieve pain within 30 minutes of my interventions. So if you've noticed from the previous video, all the goals were starting with patient, patient, patient. Here, I chose to use to relieve pain because they are both all right. Nursing interventions quickly. I will assess the pain levels using a pain scale to determine the interventions to implement. Number 2, I will administer analgesics as prescribed to relieve pain. So you can administer analgesics such as morphine depending on the pain. Number 3, I will position the patient in a comfortable position to relieve pain. So when you're writing this point, you can say, I will ensure that the patient assumes a position in which they are comfortable and does not apply or is not applying pressure on the surgical incision. Because if you are applying pressure on the surgical incision, or the position is causing some form of pressure, it will cause pain. So if you put the patient in a comfortable position which is not applying pressure on the surgical incision, it will help to relieve pain. Number 4, I will advise the patient to avoid unnecessary manipulation of the tracheostomy tube to relieve pain or to avoid applying pain. So when we talk about unnecessary manipulation, we simply mean unnecessary movements. So for example, rapid movements of the neck, bending, all those things should be restricted, especially in the acute phase or in the early phases of the placement of this tracheostomy tube. Number 5, I will provide diversional therapy such as television to divert the patient's attention from pain, therefore relieve pain. Okay, that is straightforward. Evaluation. Pain has been relieved. Pain has been relieved, evidenced by patient reporting decreased pain. Remember, reduce verbalization here because the patient is not able to verbalize. But remember, I'm not saying restrict, I'm saying reduce. And patient appears comfortable. So if the facial expression of the patient will show that they are no longer in pain. Okay, we move to the next problem. So you find that this tracheostomy tube that is inserted in the neck is causing discomfort. It will constantly cause discomfort because it is a foreign body inserted in a patient's inside the patient. Therefore, the patient will constantly be in discomfort. And one way or one area which will be massively disturbed with discomfort is sleep. The patient will have insomnia because every time they try to sleep, they will feel some discomfort or some irritation in the throat. Therefore, we have a problem we call disturbed sleep pattern or disturbed sleeping pattern. Refrain from using the word insomnia. Do not use the word insomnia. Rather, use disturbed sleep pattern. What is our nursing diagnosis? Disturbed sleeping pattern related to discomfort and airway management procedures because of these procedures that have been performed on the neck, evidenced by lack of sleep or insomnia. Our goal: patient who experience improved sleep and rest throughout hospitalization. Remember, goals have to be SMART. Interventions. Number one, I will reduce the noise, environmental noise, to promote rest. Number two, I will schedule the nursing care to minimize sleep interruption. Number three, I will ensure the airway is clear before bedtime to decrease or reduce discomfort. This is very important, where we ensure that the airway is clear. If it's about suctioning, we do that way before bedtime so that the patient is comfortable. Number four, I will position the patient comfortably to promote rest and sleep. This is also very good. I understand you can think of drugs that can be given to induce or promote sleeping, but that should not be the go-to area because those drugs have side effects, and also we don't want this patient to be hooked or sleeping induced by medication. So we would want to first try out these types of ways to promote sleep. There are also other things such as ensuring to switch off the light early. Those things that we try out in order to sleep, they can also work out here. Evaluation. The patient experienced improved sleeping pattern evidenced by an improved sleeping quality or sleeping at night. So you find that the patient will experience an improved sleeping pattern, which will be evidenced by lack of insomnia, or you can say improved sleeping quality. So if you have any questions, you can pause the video, go to the comment section and comment, ask questions. Okay, move to the third problem. So as you know, this tube is inserted in the throat. And if you understand your anatomy and physiology, you'll find that the airway is just in front. It is anterior to the esophagus. Therefore, if this tube is inserted, it means that it will put pressure on the esophagus. This tracheostomy, this tube that is inserted in the trachea, will put pressure on the tube that is proximal to it, meaning behind it. Therefore, the patient will be having difficulties to swallow. So that is why we have a problem we call impaired swallowing. Impaired swallowing, nursing diagnosis. Impaired swallowing related to tracheostomy tube placement, evidenced by difficulty or struggling to swallow food. So this is also very important under anxiety to talk about. Why? Because this patient will struggle to swallow food or will have difficulties to swallow, and they will be anxious. Go. Patient will demonstrate safe swallowing techniques throughout hospitalization. Goals have to be SMART. Nursing intervention. Number one, I will assess the gag reflex and the swallowing reflex to determine the level of impairment. So when we talk about the gag reflex and the swallowing reflex, these are reflexes that assist in swallowing food. So we are going to assess them to determine the level of impairment or the level of inadequacy or inability, rather, not inadequacy, but inability, meaning inability to swallow. So we are going to assess these reflexes. Number 2, demonstrate. I will collaborate with a speech therapist if necessary for specialized care. So this one can both be here under swallowing, or it can be on communication. So a speech therapist can also help us here in this instance, because remember, the speech, when we're talking about impairment in speaking, we spoke about the larynx. Here we're talking about the esophagus. All those parts of the neck are found on they're all found on the neck, almost at the same region. So a speech therapist can help us to determine specialized care. But rather, the more appropriate point that we can also put here is to involve nutritionists. So this particular point about a speech therapist is okay, but it is more relatable to communication. Here we can talk about more of a nutritionist. But remember, it is a valid point here, because a speech therapist will tell us or will help us to provide specialized care, because it is involving not only the airway, but it is also involving the larynx. But a nutritional or a nutritionist will help us to provide a tailor-made nutritional diet or certain prescribed foods that we can use to ensure that we tackle this problem we are calling impaired swallowing. So I hope you understand the reason why I put this point here. Number 3, I will introduce soft diet gradually as tolerated to ensure swallowing. So this is a valid point, and we have put it on impaired swallowing, not on nutrition, because of the reason being that this soft food will help the patient to swallow. Number 4, I'll encourage the patient to eat slowly and small bites for easy swallowing. So I understand that people have different ways of swallowing or eating rather. So others eat faster, others bite or chew, have big bites of their food. So basically what we are saying is that in this patient, especially those of us in African countries who partake of Mshima, you understand that this meal usually the big bites. So we would ensure that we tell our patients to avoid having big bites. Those big foods will be difficult for it to pass through the neck. So we tell them to have smaller bites and to thoroughly chew their food and eat slowly so that it can be easy to swallow. Number 5, avoid foods that are difficult to swallow. Here we've mentioned things such as sweet potatoes to prevent difficulties in swallowing. If you grew up in areas around Zambia, you know of stories around sweet potatoes. Sweet potatoes are one of the most available foods in Zambia, and you find that these sweet potatoes can choke you. Basically, they can get stuck in your esophagus. So that is why we always take sweet potatoes with water. So you find that such foods may be a bit more difficult to swallow. So in such patients, we tell them to avoid. Evaluation. Patient demonstrates. So when we talk about demonstrate, we simply mean show. Patient demonstrates or shows safe swallowing techniques evidenced by patients swallowing safely without choking episodes or pain. So in our demonstration, in our evaluation, we're simply saying the patient is now showing that they can easily swallow the food that they're taking. And it is evidenced by the patient swallowing safely without any episodes of choking or pain. We move to our fourth problem. I hope you are enjoying this lesson as much as I am. Risk for impaired skin integrity. I know I've jumbled them. I've started with the risk, then anxiety. But the correct manner is having anxiety first, then risk for impaired skin integrity. So risk for impaired skin integrity. Remember, this patient has something on the... Firstly, you've made an incision. Secondly, you've placed this tracheostomy tube and you need to tie it, isn't it? Thirdly, you understand that there can be some secretions that can be dropping as you are suctioning or that can be coming out. So they will impair the skin. So that is why we're saying risk for impaired skin integrity. Nursing diagnosis. Risk for impaired skin integrity related to tracheostomy ties. Remember, we are tying this tracheostomy tube and secretions around the stomach. So these things will cause some form of impairment or irritation on the skin. Risks do not have evidences. Risks on nursing diagnosis do not have evidence. Go. Patient's skin around the stomach will remain intact throughout hospitalization. That is very clear. Remember, the goal has to be SMART. Interventions. Number one, I will inspect the skin around this tracheostomy site daily to note for any changes on the skin. Number two, I will change wet dressing promptly to prevent skin breaks. Number three, I will keep the stomach clean and dry to prevent skin breaks. These are straightforward points. Number four, avoid tight tracheostomy ties to prevent skin breaks or irritation. So if you talk about tracheostomy tube ties, tracheostomy will be inserted on the neck, but to ensure that they are, or it is rather, stabilized, we would want to put some form of ties. So in some settings, when you don't have these ties where you can tie around the neck so that it is stabilized, others may use things such as strapping. But remember, strapping will irritate the skin. All these things can irritate the skin. So these ties that you are using on the neck should not be too tight because they will cause skin breaks. Understand the other points that we can put, such as use of Vaseline gauze. Sure, we've seen those Vaseline gauze that can be used. You can use Vaseline gauze because that Vaseline gauze does not cause skin irritation. Rather, it keeps the skin dry and a bit of, because there is Vaseline, it does not cause the skin to be too dry to the extent that it will break. So we can also put a point which is I will apply or put Vaseline gauze on the tracheostomy site or around the tracheostomy tube to prevent skin irritation and breaking. Evaluation. The skin around the stomach remained intact, evidenced by clean, dry, and intact skin without breakdowns. So we are simply saying under our evaluation that the skin of this patient has remained intact. And we can see it. It is evidenced by patient's skin being dry, intact, and they do not have any breaks. Okay. Lastly, let us look at our last problem, which is anxiety. So anxiety is always there. Knowledge deficit is always there. So you have to understand that usually we refrain from using anxiety and knowledge deficit in the same conversation or in the same nursing care plan because they usually have similar nursing interventions, but they are of course different, but we refrain because they have similar nursing interventions. Okay, anxiety. Anxiety related to difficulty in breathing, hospitalization, and inability to communicate effectively, evidenced by agitation and confusion. Again, it is okay to say this anxiety is related to difficulties in breathing, hospitalization, tracheostomy tube, inability to communicate effectively. The evidence, please. Agitation and confusion is okay. Asking too many questions is okay. But remember, in tracheostomy, we are saying it will be difficult for the person to verbally communicate. So you find that it is easier to say the patient will be agitated, the patient will be confused. Okay, the patient will write down a lot of questions asking about their condition. They are anxious. Okay, goal. The goal is to allay anxiety throughout hospitalization. Again, you can start with patient. Patient's anxiety should be allayed or will be allayed throughout hospitalization. It is okay to put it like that. Interventions. Number one, I will explain all procedures clearly before performing them to allay anxiety. That is very clear. So you have to explain all the procedures to be done on the patient to allay anxiety. Number two, I will encourage the family presence and support to allay anxiety and promote a sense of belonging. So in this patient, what we want to necessarily do is to ensure that the patient's family should be present and also be supporting the patient. This will help to allay anxiety and also promote a sense of belonging. Number three, I'll provide a calm and quiet environment to allay anxiety. Of course, that is very helpful. Number four, I'll encourage the patient to express fears. So this is where we say I'll encourage the patient to ask questions and I'll answer them accordingly to allay anxiety and promote knowledge. So express fears and concerns. But remember, keep in mind, as we are learning these things, keep in mind that these patients' verbal communication will be impaired to some extent. There are other points that you can put here that are very important to allay anxiety. You can explain the procedure, the condition. You can do all sorts of things. But I'm not mentioning most of those points because we have mentioned those points under knowledge deficit in the first video. So I repeat, check it out if you've not checked it. Then the last one is evaluation is patient's anxiety has been allayed, evidenced by patient appearing calm. Okay, so we can say it like that. We can say patient not asking too many questions. We can say it in so many different ways, but this is the best way that I have come up with. So that is all with the second part of the tracheostomy nursing care plan for a patient with a tracheostomy tube. So key takeaways. Number one, this is a surgical procedure in which a tracheostomy is made on the neck. So this tracheostomy or stoma is made on the neck and a tracheostomy tube is inserted to facilitate breathing. So it can be done in patients who have obstruction in the upper airway, severely sick, unconscious, cancers of the neck or the larynx. It can be done in severe bends of the face and the neck. So those are some of the indications for tracheostomy. Problems are centered around impaired breathing, pain, altered body image, communication, skin, anxiety, they are centered around all that. So we have tackled all these things. So if you have any questions, you can communicate in the comment section and let us have an interaction. Let us communicate. Thank you for listening, paying attention, and watching our videos. Thank you for everything. If you have any questions, contact us. If anything personal, you can contact me through Gmail, which is calebmlonga@gmail.com. Thank you so much. Till next time. God bless.